All right. Well, welcome to this unrehearsed podcast. I'll just preface that here a little bit. I'm going to try to do this activity with you live and record it as a podcast. So, what I wanted to do, my objectives for this podcast, is to show you how to perform, using an example, the drug information type of skills that are required on the model pharmacy exam. So this is equivalent to station one. So on the model pharmacy exam, there are three stations. The first station is drug information and processing prescriptions. Station two is computerized order entry verification. And station three is filled prescription verification. So we're not going to do the verifications in this podcast. We're going to be focused on the drug information skills using Lexicomp online to be able to look up information and also read and interpret and process prescriptions that don't have problems. So, with that as a little bit of a background, what I will show you on the left-hand side is the web browser, and you're going to be looking up a lot of information and doing things through the lab website. On the right-hand side is an example of the packet of prescriptions that you're going to get on the exam. So, for example, you're going to, if we look on, so let's focus on the right-hand side of the screen, and we'll go through the 6 prescriptions that will compose the packet that you will receive for the model pharmacy exam. So, looking at the prescription, and one thing I will tell you ahead of time, you'll notice on the right hand side we have the prescription intake information. So, for each prescription, you would normally need to gather information from the patient or look up information from the patient profile. That information includes the patient's age and date of birth, their gender at birth, their address, and often their telephone number. You would then also determine whether they're paying cash or have a third party insurance card that's going to pay for it. Then you would kind of update or verify their patient health information, that is their profile information. In these activities, the ones that we focus on whether they have any drug allergies, allergies to any medications, or any other chronic medical conditions that we should be aware of. So that's number 3 with the patient health information. We would then just confirm with them about whether or not that they want to use safety caps. And the assumption is they will use safety caps unless they specifically indicate they do not want safety caps. And we would document that if that was the case. And then lastly, the verification of whether they're going to wait for it, come back and pick it up, or have us deliver it. So anyways, that's you're going to see that on the right hand side, and you'll notice in red I've gone ahead and already pre-filled out to speed up this podcast a little bit. I've gone through and I will show you where I found this information, but I've gone through and already filled out their profile information, so you didn't have to wait and watch me type all that in. So, with that in mind, let's kind of look through what we have here. On the top left, so in this area right here, you can see the prescription, and it is for Sylvia F. Jones, dated on September 2nd, and it was for Cellcept 500 milligram tablets, dispense 120, with the instructions or SIG from the from the doctor to take 2 tablets by mouth twice a day for psoriasis. And the prescriber was Dr. George Platts, and here's his address. He's also authorized 2 additional refills. And if we look on this prescription entirely, we can see that it was a telephone prescription, and it was called in by Brad Evans, who is a nurse, and that the doctor has authorized us to dispense a generic. So I won't go through that in detail for every prescription, but we can see the prescription here on the top left. On the right-hand side contains all of that profile information that I've been already discussed. And then lastly, down here below that is the documentation that we're going to require of you on the exam. And this is where, again, you would indicate whether or not it's a controlled substance, and that's honestly a reminder for you, if that is the case, to add additional information on the face of the prescription. I'll talk about that in a little bit. And then lastly, when we do go through this analysis, if we do find out for any reason that there's some reason, we're going to perform a drug utilization review. And during that, if we don't find any errors or any reason to contact the prescriber, we'll mark that here, and we will go ahead and type a label and go ahead and dispense the prescription. However, if during our utilization review we find an error, we would indicate the type of error and write some description about it. And then finally, you would indicate on the exam your proposed change. And it doesn't have to go beyond this, but based off of the problem, it could either be that the dose is not right, therefore the dose needs to be increased, or the dose could be decreased, Or it could be that this drug shouldn't be taken by this person. Either it's an allergy or a contraindication, a reason not to take it. Or lastly, it could be that they can take it, but you're going to have to talk with the prescriber to change the instructions or to the patient to make sure that they change the way they take it to make sure that they can take it in a safe way. So those are the main things we're looking for. All right. The difficulty with this test, if there's any difficulty, is the fact that you get 6 prescriptions, and it's your job to kind of define which ones are okay to fill, which ones are not okay to fill. So what I would do is look around at all 6 prescriptions first. So here, like I said, we have Sylvia Jones and a prescription for Cellcept. And then going through the packet, we can see that the next prescription is also for Sylvia Jones, but it's from a different doctor, and this one's for Lipitor. So 2 prescriptions for Sylvia Jones. Let's see. Then we had Duck Wynn, who's got a prescription for some Provigil, obviously to treat some narcolepsy. All right. Then what do we have here? Oh, we have a third one. This would be our third one for Sylvia Jones, and this is for some Welcall tablets. So we have 3 Sylvia Jones. We have one going back up to Duck Wynn, and let's see here. We should have 2 more. Let's see. Oh, the fifth one is for Alice Sawyer for some Nucynta. And then lastly, it looks like we have a prescription for Teresa Sykes for some Bactrim DS. Okay, so 6 prescriptions, but it will always be, and I'm telling you for the exam, it helps you to understand the format of all this. There will always probably be multiple prescriptions for at least one patient. And that is because part of the problems we want you to be able to identify and then know how to handle would be a possible drug interaction. So this is how, during the test, you can proceed through this however you want. But the first thing you're going to do before you do anything is to document all of the profile information. So let me show you how to do that first. So looking over here on the left on the lab website, what you would do is go to dispensing lab functions here in the middle, click on the prescription drop off. And then a quick link is right here to the pharmacy dispensing software simulator. So this is where you would go to actually type your labels when you're going to process a prescription. The reason I'm deciding to come here is this is a quick way to get to the patient profiles, because the very first thing on this program is that you select the patient. So here, if we want to look at that information, let me click on View All Patients. And let's see, our patient name here is Sylvia F. Jones. So if I go down here to Sylvia F. Jones, and I'll try to put it up near the top. So where'd she go? Sylvia F. Jones is right here. So you can see that that information is what I've written or typed into this profile information. And you need to do that for all of the prescriptions. Now, 3 of them, like we said, are for Sylvia, so it'll be the same information on all 3 prescriptions. But for my other patients, if I come back over here, there's Sylvia again, but here's some information for Duck Wins. So I got that information for going down to the wins and right here for Duck, and we can see his information there and so forth. So the first thing that you need to do is to go through and enter all of the information. That includes their demographic information and especially their health information, and that is whether they have any allergies or any chronic illnesses. And again, I chose Duck here because he doesn't have any. But if I scroll down, let's see here, let's go down to Teresa Sykes. So here's her demographic information. And again, let me come over here and show you where I got that information. So where's old Teresa Sykes? Here she is. So on the left, you can see the profile, and I've rewritten that information here. And she's an interesting patient because she definitely does have some drug allergies. She's had an allergic reaction, a severe reaction to penicillin in the past. And it looks like her chronic illnesses include hemorrhoids and anemia. So anyways, that's important information and where it comes from. So I'll back up here and let's go back to the top. So now that we've gone through and written the profile information for each of our patients, as I was saying, we know that 3 of these prescriptions are for Sylvia Jones. And again, since part of what you're going to have to do is to identify a drug interaction, what we want you to be able to do is to take these medications and identify that. So the first thing I would recommend that you do is check for drug interactions for any patient that has more than 1 prescription to be filled. Okay, so to do that, what I'm going to do is come over here and click on Lexicomp Online. So all of the drug information all of the drug information you need for this exam needs to come from Lexicomp Online, and it's been keyed to that, and all that information that we are expecting that you'll answer is based off of what's in Lexicomp. So make sure that you do use Lexicomp. meaning don't just Google it. We want you to learn. An objective for this whole lab, this whole exam, is to become well schooled at using and being able to look up information in a reliable professional drug information resource, like in this case, we want you to learn to use Lexicomp Online. And we choose this one because not only is it very commonly used in practice of pharmacy, it's probably the best handheld version. So if you're going to use your iPhone or your Android device when you're out on rotations, it's probably one of the most common sources of drug information used for that. So that's why we want you to get used to doing that. So a little bit of background. Let's now focus. Larry, let's practice on doing a drug interaction. So to do that, we're not going to just jump into the search bar right here. We're going to start by clicking up here where it says interactions. So we want you to use the drug interaction checker. To do that, you're going to enter in one drug at a time. So in this case, my first drug here is for Sylvia Jones, and she has three, is Cellcept. So Cellcept. I start to type it in and it pops up, so I'll add it. Now let's see, let me come back over to here, and what was her second drug? Her second drug was Lipitor, so let me come over here and I'll type in Lipitor, and there it pops up. And let me see, what was her third one? So if I come back over here, I can see, oh, here it is, it was Welcall. So let me type in Welcall. Okay, so there's roll call. So here are the three drugs or the three prescriptions that I have for her. And so let me go ahead and now click the Analyze button, and it will check for drug interactions. Okay, couple of things to get used to right away. This is the kind of key. It's a summary key to kind of quickly let you know how significant any interactions that you may see down below here are. Okay, and that's the reason why we're having you practice this. Not all drug interactions are what we consider are clinically significant or that are serious enough to have to preclude the patient from taking the two medications, or may not be serious enough for you to have to contact the prescriber. Okay, and so the way it works is alphabetically, and starting with the letter A. A is the least severe, or in this case, it actually says no known interaction. So A's mean they're perfectly safe. There's no problem between those two. You'll notice if it's no reaction, then it probably won't even pop up. A letter B is one where there is some evidence of an interaction, but it's never been shown to be significant enough to warrant not taking the two drugs together. What you see most of in clinical practice, to be honest with you, are this area here where it says C and D. C meaning, watch out. There might be a problem. They do interact and it might cause a problem, but not in every patient. So you really need to be careful and just double check and let your patient know to let you know if anything happens. These are what you'll see most often, is that there is an interaction and it could be significant. So these are ones where it takes a lot more of your knowledge that you'll gain while you're in pharmacy school to really be able to know and interpret, at which point you definitely may need to contact the doctor, explain what's happening, and come up with some sort of resolution. Okay, or it goes to the end, the last or the most severe reaction is an X. An X in a red box means this is a known interaction and it's known to have significant health effects such that this combination should absolutely be avoided. So the A's and B's are the easy answers. Oh, they're okay. You can give those two together. The X's are an easy answer. It means absolutely not. You're going to have to do something about that combination. You can't have the combination. In practice, the C's and the D's are the more difficult because they means it requires some clinical judgment, talking with the prescriber and coming to some resolution. Okay, now getting back to our answer. It turns out, remember, we had three drugs. We had Cellcept, Lipitor, and Welcall, but it shows us that there is only one specific interaction. There is an interaction between the Cellcept and the Welcall, and even without going any further, we can tell by this red X that it's not a good one. It's a significant interaction. Okay. But if you look over here in the documentation, I can now already, between those two drugs, between Welcall and going back up to the top to the first one, Cellcept, there's a drug interaction. So you don't have to write this under both of them, but I know for sure that I need to indicate here that there is a drug interaction. So I'll come over here and I'll type in X, and that's a big X, so let me make that a little bit smaller. But we know that there is an interaction between those two. So first off, my documentation is to indicate that there is an interaction. All right, but you'll notice now that's not the point to this activity. It's to not only identify that there's an action, but to summarize its significance and also describe the management. What do you need to do? What does it say about that? Okay, meaning I want you to come over to here. And again, we've already identified the significance rating as an X. So I can come back over here and type X. Okay, and that's not just an X to indicate it, it means that that is the level of the significance rating is that of an X. Okay, but now to get to the patient management, this is what's important. Come back over here to the drug information and click on the link between the CellCept and the well call. There's a link here. If I click on that, what I want you to be able to see is it gives you not only the title of the two things that are interacting, but the risk rating. Like I've already said, we could tell it was an X, which means avoid combination. So this is really what I want you to document over here. So I'm going to come back over here, and what you would need to document for this section is this X avoid combination. So there's that documentation. Let me move that over to here. Now we can come over and look at the management because there is both a summary, and the summary is really helpful. It says bile acid sequestrants, which is what the well call is, may decrease the serum concentration of mycophenolate. So if you think about it, this bile acid sequestrants basically bind to and hold on to the mycophenolate, meaning it can't get into the blood, which would keep the mycophenolate, which was the generic name for the CellCept, from working. So that's not a good thing. So what does it say here under patient management? Patients receiving mycophenolate should not receive bile acid sequestrants since it could impair the mycophenolate effectiveness. Okay, so that's what I would expect for you to rewrite. So, and you're going to be writing this by hand. I'm lucky enough, I guess, to be able to do this electronically. But you are going to have to take that information and summarize it. Again, you don't have to be word for word, but it does need to convey the idea here so that you've used your drug information skills to put all three possible prescriptions that this patient is on and to identify that the CellCept and the well call are drugs that you're not going to fill because of a significant drug interaction. Okay, and when you call the doctor or the prescriber, you have the information about how to manage it, which is simply saying these two cannot be given together. We need to avoid that combination. So the last part of your documentation would be to come down here and to type an X in right here, and under the avoid this combination. Okay, it's not a matter of just having to increase or decrease the dose of one of the two drugs. The management part right here says that they should not receive bile acid sequestrants while they're on CellCept. So clearly we're going to avoid that combination. The doctor would probably continue on the CellCept, but find another medication or an alternative to the well call, which is used for the cholesterol. So that's clearly a drug that would need to be changed. All right, so you then normally only need to write that on one of the two prescriptions, but just for the sake of completeness, I'm going to copy that there, and let's scroll down here to the well call, and I will put that same information over here so that you can see on my thing here that the well call and the the CellCept are medications that we are not going to fill because of a drug interaction between them. Okay, so I'll come back up to here, and that's how we would do that. So what that leaves is, I'll be honest with you, is there any reason why, though, that we can't at this point fill the Lipitor? And I would say no, it does not interact. So while I'm not going to fill the CellCept or the well call, there's still no reason at this point for me to be worried about the Lipitor for her. Okay, so what we did is we have first identified the possible drug interaction out of the 6 prescriptions. We've eliminated 2 that we know we're not going to fill because we need to contact the prescriber about that drug interaction. Okay, step 2 on this exam is that you will also have then one medication that has a problem with the patient's profile. And by that, what I mean is either their drug allergies, that is, they've been prescribed a drug they're allergic to, or they've been prescribed a drug that is what we call contraindicated or should not be used in somebody who has a certain chronic illness. In this case, in this example, chronic illness of obesity or eczema could be a reason maybe for a drug not to be prescribed, in this case to Sylvia Jones. Okay, so it's really focusing on this issues right here. So, well, let's look through here. So what I would do is now that I know that these two are done, so I don't need to worry about the cell sept or the well call, I can look here at the Lipitor, and let's see right here. Here's Lipitor for Sylvia Jones, but remember, she doesn't have any drug allergies, but she's obese and has eczema. So now what I'm going to do is come back to my drug information source over here and type in Lipitor. I'm going to pull up Lipitor. And for this drug profile problem, we're looking under contraindication. So a big part of what we're trying to do is kind of focus on these sections over here. So at this point, the section that you're going to want to look at for this is warnings and precautions. So if I click on warnings and precautions, I can click here and see contraindications. And again, this is the main part that I want you to do. It could also be a precaution or a warning, but we're really looking for a drug that is absolutely should not be given to this. So look at right here under contraindications for atorvastatin, which is the generic name for Lipitor. It says hypersensitivity, meaning allergy to atorvastatin or any other component in the formulation, active liver disease, unexplained persistent elevation of serum transaminases, pregnancy, or breastfeeding. Okay, and we will, for the sake of this exam, not be considering the Canadian labeling. That doesn't mean it's wrong, but since we're doing this course in the United States, we will focus on the contraindication specifically in the labeling for the US products, versions of those products. So in this case, if I look at those contraindications and look over here under both obesity and eczema, I don't see any reason that Sylvia Jones could not take Lipitor based off of contraindications. So I don't think that prescription applies for a contraindication. Well, let's keep going then. All right. Ooh, here's Duck Win, and he's got Provigil, but he doesn't have any allergies or chronic illnesses, so that's not going to be a profile problem. So, okay, let's keep going. There's the well call. We've already crossed that one off the list. Here we go. Here's Alice Sawyer has Nucynta, and she has both hypertension and diabetes. So let's come back over to here and type in Nucynta and pull it up and click on it and go to contraindications, warnings, precautions, and look under contraindications. And again, I'm looking for hypertension or diabetes being a problem. If you read this here, it says hypersensitivity to the generic name or any component of the formulation, respiratory depression, asthma, hypercapnia, uh, being on a ventilator, GI obstruction, including paralytic ileus, or the use of a MAO inhibitor. So it's got lots of contraindications, but none of them really talk about high blood pressure, hypertension, or diabetes. So once again, I'm not getting a sense that these conditions here would be a reason that you could not take Nucynta. So I'm thinking that one seems okay for that. So that's not a problem. So we've only got one left. So let's see if we can come up with that. Teresa Sykes, who is allergic to penicillin and has hemorrhoids and anemia, has been prescribed Bactrim. So I'm going to come up to here. Type in Bactrim DS, click on that, click over here on the Bactrim DS, click on warnings and precautions, and right here it says hypersensitivity to any sulfa drug. Oh, but she's not allergic to sulfa. It says trimethoprim, history of drug-induced immune thrombocytopenia, use of no. Right here, megaloblastic anemia due to folate deficiency. So there is definitely one specific kind of anemia that is a contraindication to the use of Bactrim DS. Well, right here it says anemia. Now, in one sense, that's a little vague. There are lots of different types of anemia, but given what I know, which is simply that she does have a history of anemia, that I would either need to talk with her and find out definitely more information about the anemia, or more likely contact the prescriber and say, hey, I have a history of anemia for this patient. This medication is contraindicated in a patient with megaloblastic anemia. Is this going to be a problem for the patient? So I would not fill this prescription until I get more information. Well, there we go. So what I have right here then is what I would consider a drug allergy or contraindication. This is, in this case, it's a drug contraindication. All right. So my summary in this sense is that this medication is contraindicated. So this, you don't have to worry about the summary or the significance rating. What I would do, come over here under management, or my summary is going to be contraindicated in patients with megaloblastic anemia, and therefore my management would be to uh, avoid drug. Okay. And then lastly, so again, I'm going to come down here and say that because of this is a contraindication, what we need to do is avoid this drug. Not so much a combination, but this drug needs to be avoided. Now, this patient may come back, or the prescriber may come back and say, well, it was hemolytic anemia, not megaloblastic anemia, at which point we could give it. But since we do not know, and that in the contraindications, it clearly shows that megaloblastic anemia would be a contraindication, I'm definitely going to mark this as a possible contraindication due to this reason that we need to avoid the drug, and kind of mark that as well. So there you have it. We have identified and indicated for me on the exam which medication would not be filled until contacting to the prescriber because of the potential of a drug profile interaction. In this case, profiles being allergies or chronic conditions that the patient has. All right. Well, if you think about it, we've now marked off at least 3 of the medications now, leaving 3 remaining. Okay. So on the exam, the remaining 3, you're going to have 2 prescriptions that do not have any problems, that you are going to actually be able to fill and type a label and process the prescription like you would normally. There is only one other possible error, and that possible error is going to be a dosing error. So there is going to be one of these medications where the dose that the doctor has prescribed is not correct for that patient. And so I'll go ahead and pull up Sylvia Jones because this is one of the prescriptions we still haven't found any sort of problem with. And what I would tell you is if you look at Sylvia Jones, you always need to consider the age of the patient because there are pediatric dosing, there's normal, what we call normal adult dosing, and there's sometimes geriatric dosing or dosing that has to be adjusted because the patient's either very old in the form of geriatrics or very young in the form of pediatrics or more of the normal just adult dosing. So we want to double check to make sure that these medications are dosed appropriately. And one of the medications in your packet will not be dosed. But this is the one that's a little more difficult to find. So I would save this one for last. But they're not hard. Let's do this. So again, Sylvia Jones, let's check up the Lipitor dose. So I'm going to type in Lipitor and pull it up and click on this. And again, remember the whole point to all of this is to get you to understand how to use the drug information monographs with all of these sections right here. So right here, since we're checking the dose, I'm going to click on dosages. And I'm going to look here under normal adult. Now, I looked over at a 38-year-old. So pediatrics are usually considered to be children less than 18 years of age, although sometimes the upper teens are considered adults based off of the dosing. But, definitely be thinking pediatric when they're less than 18 years of age. Also consider geriatrics when you're between 60 to 65. And again, that's a loose definition, but certainly 65 and older, you want to look at if there's any sort of geriatric dosing considerations. But even as low as 60, sometimes you'll see some doses altered. So 38 years old, we're good to look for a normal adult dose here. So you'll notice there's a lot of information here. It says, this is also, I should clarify, the dosing for most medications can differ depending on the reason, what we say the indication for the drug. So it's important to look here under the instructions for the SIG here, instructions for the patient. It says 1 by mouth daily for high cholesterol. So this patient is taking this for their high cholesterol. So and again, the reason that's important is that it could be a different dose based off of this for heterogeneous familial hypercholesteremia, or it could be different if the patient has diabetes. But in this case, we're talking about a patient with primary prevention to lower their cholesterol with no history of diabetes. So if we look under that dose right there, we can kind of see that moderate intensity therapy is anywhere from 10 to 20 milligrams once daily. And what did the doctor prescribe? 10 milligrams, one of those once daily. So I'm looking at 10 milligrams daily as fitting right along with what I might have expected for this drug to be used in this patient. So I'm right now at this prescription not really concerned about that dose. That seems like a normal dose. So let's go beyond. So I don't think that's a problem. All right, here's another one for Duck Win. He has Provigil 100 milligrams once at bedtime as needed for narcolepsy. So let's check that dose. So I'm going to come over here and type Provigil and click on that. Click on that drug. Now remember, what section did we want? We wanted to go under dosages. Click under normal adults since we've got a 25-year-old, so that we can be kind of a normal adult thing. And again, we said it was for narcolepsy. So if we come over here and look under not sleep apnea, we want to look under narcolepsy. So, oh, where did it say? Oh, there's narcolepsy right there. Okay. So it says initially 200 milligrams as a single dose in the morning. So 200 milligrams is a single daily dose in the morning. How does that match with what the doctor wrote? One of the 100 milligrams, so that seems low. 100 milligrams is not 200 milligrams, and every once daily at bedtime for narcolepsy, but this says in the morning. Oh, this is a problem. I think we need to talk to the doctor about that because looking over here and what this is telling me that I would normally expect an adult to take 200 milligrams once a day in the morning, and this doctor is telling me to give 100 milligrams in the evening for narcolepsy. That doesn't seem to make sense to me. So I'm not going to fill that prescription without talking to the doctor. So I'm thinking this could possibly definitely be a dosing error. So I'm going to mark on here that this is a drug dosing error. Okay, and so my summary is that dose, let's write normal dose, is 200 milligrams QAM, okay, uh, not 100 milligrams QHS. So that's kind of my summary. My management basically is my recommendation would be to increase dose to 200 milligrams and change time to every morning. Okay. And so the last thing here is my proposed change. What am I going to do? Is I want to actually suggest that the dose be increased, not decreased, because we want to go from 100 milligrams to 200 milligrams. And though I'm going to suggest that we change, in this case, change the administration time. So this one's going to get 2x's because there's two issues going on here. We need a higher dose and we need to do it at a different time. With all of those things in mind, it would be fine to contact the prescriber and make those changes if they authorize that and go ahead and fill the prescription with the changes. But certainly I'm not going to fill this prescription until we contact the prescriber. Okay, hopefully you saw where all that came from and how we did that. Well, wait a minute. Good news. We have identified all of the possible problems on the all the drug information issues on the exam. If you think right here, we have identified a drug dosing error. Okay. We have also coming up here identified. Let me go back up to went the wrong way here. There was the dosing error. There is. Sorry for making you dizzy here. Drug contraindication. So we have the dosing error with the Provigil. We have the drug allergy contraindication with the Bactrim DS. And like I said, we have the drug interaction problem between the Welchol and the Cellcept, the very first prescription for Sylvia Jones. So that should leave you 2 prescriptions. So out of this packet of 6 prescriptions, the prescriptions I will still be able to fill at this point is the Lipitor 10 milligrams for Sylvia Jones because, again, it doesn't have any problems with her chronic illnesses or her profile. It doesn't have any problems with the dosing. The dosing is appropriate. It doesn't interact with her other prescriptions, so there's no reason we can't fill it. So in this case, I'm going to come over here and type no errors. And at this point, you would actually then type a label for that one and actually process it. So there's no reason that we can't do that. And then the other one we came across that we could fill was down here at the bottom was Alice Sawyer's Nucynta. So, maybe we didn't check the dose for this one since we had already found that. So let's go ahead and check the dose just to make sure that there aren't 2 dosing errors on here. But let's just show you for the sake of practice here. Nucynta. And I'll pull that up and pull it up over here. And I'll remind you this was under our dosages and normal adult. Well, this is 65, so we may want to look for geriatrics. I'll show you that here in a minute. But let's click on geriatric dosing here, and it says dosing. Refer to adult dosing. Initiate therapy at the low end of the dosing range and use with caution. So again, we did consider the fact that she's 65 years old and checked out the geriatrics, but it basically says to refer to the adult. So now I'll click back on adult. And this is one where you've got to be careful because there are multiple reasons why you might be able to use this one. This says nerve pain. Well, nerve pain is another way of saying neuropathic pain. So this is the section here we would want to look is under neuropathic pain. And it says for patients with diabetes, and look over here, Alice Sawyer is diabetic. She has a history of diabetes as a chronic illness and has nerve pain. So neuropathic pain associated with diabetic peripheral neuropathy would make sense. Okay, so again, we don't know all about her profile, but we're looking at looks like Nucynta, regular release. It does not say anything about the extended release tablets, and it says 50 milligrams twice a day. So let's see if that makes sense. Okay, opioid native, it says initially 50 milligrams every 12 hours. So 50 milligrams every 12 hours is 50 milligrams twice a day, and that seems like a very reasonable dose. So once again, this prescription here would be the one that we fill for her, for Alice Sawyer. There's no reason. It's not a dosing error, it's not a profile problem, and it's certainly not a drug interaction. So anyway, so I'll end this podcast at this point, meaning we have completed all of the drug information and documentation needed for the prescription errors. And again, that's going to be a dosing error, a drug profile, which is an allergy or contraindication error, and then two drugs that interact and can't be given to each other. I'll record a second podcast that picks up from right here where we'll actually talk about how to process the two prescription, in this case the Nucynta for Alice Sawyer and the Lipitor for Sylvia Jones that we would fill. So you would then at that point fill those two prescriptions. Now I will cover that in the other podcast.